Hello everyone, Dr. Ash is here, and today's discussion will be around Mr. Ronnie Coleman recent hospitalization regarding his health. Before I get into the video, I will leave my email as well as my BTC account in the description. If you can contribute to this channel, it will be great. And beside all of that, there is a link for TRT. If you have any question regarding TRT, testosterone therapy, please contact them. If you have any question from me, I will charge you for certain amount based on your question. So please send me email if your question worth spending. So that's for that. In this video, there's two parts. One, I explain about possibility how Ronnie Coleman got sepsis, what kind of antibiotic they gave him, and also I will explain what are the important cautions that we need to take as a bodybuilder not to lead to prevent getting sepsis, because it's very possible anybody face this problem. So I hope you enjoy this video. And the reason I make this video is because so many bodybuilders, due to their lifestyle, could face the same thing. I don't think what happened to Mr. Coleman is necessarily related directly with the, for example, use of steroid or things like that, or injection, but for many bodybuilder it could be that, and I will explain it in this video. I try to prevent any speculation and any kind of fake news. I only talk about what I know, and I'm gonna share it with you. How can bodybuilder face this kind of infection, and what is the best way to prevent it? So if you're interested, please follow up. First of all, Mr. Coleman got sepsis. So Ronnie got sepsis, and based on what he said in this video, he almost died.
Man, let me tell you, these past few weeks have been some of the toughest of my life. The boy was hit with sepsis, and it nearly killed me. Had it not been for my 13-year-old daughter, it probably would have. And y'all know me. I've been faced with some battles in my life, but nothing like this.
And it's true. Sepsis is a very dangerous type of infection, and I will explain to you what is sepsis in general. Sepsis is when the pathogen, especially bacteria, in rare cases fungi, enter your bloodstream. So if some tissue localized get infected, for example due to injection, and from there you kind of face some kind of situation that capsule, that cyst kind of open up through your bloodstream, and some bacteria or even the toxin that they produce enter your bloodstream, then you can face sepsis. So the infection itself cannot cause sepsis, but when those toxins or those bacteria enter the bloodstream, they cause your body to react, or better say overreact, to this kind of situation, and then the lots of cytokine will produce and chemokine inside your bloodstream, and these chemokine and cytokine technically is an alarm that asking for more white cells to attack the infection. But however, in the sepsis situation or cytokine storm, in some are a viral infection, that's different from this, but both caused by cytokines. When that happens, your immune system cause inflammation within all organs. The first organ that receive the hardest is the kidney. So mostly people who face sepsis, they got a kidney failure, and it goes to all other organs, and your immune system start to attack your healthy tissues, and overall inflammation and the damage that can cause will mostly lead to the organ failure and eventually death. So this is the sepsis. This is what we call sepsis. So how can it happen to bodybuilder? One thing that very common, this is very simple thing. Some people chewing their nails, chewing their fingers, the side of the fingers, that can lead to sepsis as well, especially because you go to the gym, All of those equipment are not clean, and when you bite and cause bleeding within your tip of the fingers, you making an opening for the bacteria to enter your system, and it can cause localized infection or it can cause even sepsis. Regarding what happened to Mr. Coleman, well, there are two idea I have that can lead, they could have lead to this situation. One, any kind of IV or any kind of injection in general can lead to sepsis. And Mr. Coleman have been gone for so many stem cell therapy. Hypothetically, I'm not saying that possible. Hypothetically, if one of these injection, one part of it went wrong, so they inject stem cell or they inject the PRP into Mr. Coleman, and some infection for one way or another enter his system, that could have one of the cause of the sepsis, in my opinion. Another thing that could have caused this problem is usage of cortisol. As you all know, Mr. Coleman been into so many surgeries, and I don't know, more than 20 surgeries if I'm not mistaken, for his back and legs and hips and knees. So some of these surgeries cause long-term inflammation and pain. So sometimes doctor give you cortisol, and cortisol naturally suppress your immune system. So if it suppress your immune system, eventually it open up the gate for the infection to kind of find its way through the bloodstream. So that's another possible. And there are some other low possibility, like skin infection or some cyst and so on, which I'm not sure. But if I have to give, the highest possibility is one of these two. Anything else could also happen, but this is the possibility that I can think of. This was the first things that came to my mind. Now, regarding bodybuilders, how can we prevent sepsis? First of all, as I show in so many videos, when you want to do injection, wash your hand very well. I'm against OCD, but you need to wash your hand before doing injection. Second of all, the needles that you use, it's best you use one needle for drawing the liquid, for whatever it is, testosterone, HGH. It's good if you change the needle to the new needle before you do the injection. So these are very important points. And after all of that, alcohol swap. It's very, very important. Some people, when they want to swap, just like kind of like at locally, just like moving the cotton right at the place, you need to swap. Alcohol doesn't kill the bacteria right away. It causes it to clean. It basically dissolve fats, and with dissolving fats and move it away, it moves the bacteria and other germs away from the area. So this is very important. Again, use one cotton swab to clean the area. After injection, use a new cotton swab to clean up after your injection. These are very important. Do not chew your fingernail. It's very important. If you do that, wear proper gloves which can cover your finger when you go to the gym. Be careful some guys are very hairy, so like for example, if you keep on sitting and doing leg squat, or if you even at work you have to sit all the time, there's a possibility you get cysts, especially at your buttocks, and those cysts also very dangerous. They can lead to sepsis if you don't take it very serious. So even though any gum infection, so generally if you have any type of injection, make sure immediately see the doctor, and if they gave you the if they gave you the medication, please follow the medication throughout. There are several antibiotics that possibly they give to Mr. Ronnie after he went to the hospital, One is tazobactam. Tazobactam is a very strong antibacterial, which is beta-lactam and beta-lactamase inhibitor. And if you have question regarding this, please leave in the description. I will explain later what does beta-lactam and beta-lactamase are. But generally, beta-lactamase is an enzyme that works for the beta-lactam. So these two are very strong. This antibiotic is very strong against the gram-positive and gram-negative bacteria and anaerobes. So it can kill all of them. It can control all of them. The other one is most probably kilostatin, vancomycin, and cefixime. These are all possible dose combo because they don't only give one antibiotic. They give the cocktail of antibiotics, so they don't want to leave any chance for any kind of bacteria to survive, and they have to control it very fast. And of course, for some cases, immediately they have to do the dialysis because some people face kidney failure, which thank God in the case of Ronnie Coleman it was fine. So this was the overview of the sepsis and possibility that anybody can get it. I hope it was useful and informative for you. Please don't forget to like and subscribe, and till next time.